Costochondritis, and vertigo. And if any of you have had vertigo, it's not fun. Racing heart rate, increased blood pressure. He's my age, and he's on blood pressure medication, among other things. Hello everyone, we have an interesting case here. We have Rolf here who, when I say an interesting case, he's been to a lot of different doctors, right?
Yes,
I'm not even going to go into how many different types, but the complicated thing with him is he's got a few different conditions, and the problem is when you go to one specialist, they're only going to focus on that one condition. You go to a gastroenterologist, he's going to focus on that condition. So let me get right into it. He is dealing with costochondritis, which some of you probably have seen the videos I've done on costochondritis, inflammation of the rib head where it meets your breastbone, your sternum. That's all it is, but it has to do with your posture, with your middle back, because those ribs wrap around and attach to your thoracic spine. So that's number one. He's dealing with that, but he's also dealing with the side effects of costochondritis, which are racing heart rate, increased blood pressure. He's my age, and he's on blood pressure medication, among other things. Sorry, I had to share that, but you're on several medications.
Yeah.
And two of them are for his blood pressure. And again, he's 49, I'm the same age, I take 0 medications. He's already on 4 or 5 now for these conditions. So my goal here is to get to the cause of the problem, fix it, address it, and that will let all the symptoms will go away after that, and we can get him off these drugs. Then he's also on 2 PPIs, proton pump inhibitors, for his hiatal hernia. So there you go, I let the cat out of the bag. He's got costochondritis and hiatal hernia, but the connection between the two is they're both posture related. They're both related to his thoracic spine. If you look here at him laying here, you can see his thoracic spine kind of hunches over more than it should, and you can also see it when he's standing. But more importantly, he's got a little bit of rotation here in his thoracic spine. His musculature and rib heads are higher back here on the left, and if you look in the front of his chest, his ribs stick out a little bit in the chest area on the we saw it on the left side for you, right?
Yeah.
Correct. So he has excuse me folks, he has not only some mid-back pain, but pain in the chest area on that same left side. So that's number one, and that's going to cause his heart rate to go up, his blood pressure to go up. It almost feels like you're having a heart attack or a panic attack. And this is very, very common with people that suffer from costochondritis. Hiatal hernia sometimes, but it's not as common to see that. The reason for a hiatal hernia to cause that heart racing or even low blood pressure sometimes is because the vagus nerve goes through the hiatus. So we're going to address his costochondritis. We're going to address the hiatal hernia with a hiatal hernia maneuver. We're going to deal with the source of it all, which is his posture and his thoracic spine. And then he's also, the third whammy is dealing with vertigo and dizziness. And he's gone through all different tests, been diagnosed with Gilbert syndrome and vasovagal vertigo, and I think he's been misdiagnosed with that. So we're going to work on the neck region, which he has some disc herniations in his neck, and that can create some vertigo and some dizziness. So the doctors checked the neurological side of it. They did the Epley maneuver on him. So we're going to do a little bit of that. He's going to do that at home. We have a video on the Epley maneuver, a home treatment for vertigo. You can certainly check that out. And we're going to show him how to do the Epley maneuver so he knows how to do that. And we're going to adjust his neck, which is going to be really important for the dizziness. And we're just going to keep track of it over the next couple of treatments, few weeks here. And we'll definitely do a follow-up video, or we'll add it on to the end of this video. Okay. And you've also had some back pain in the past with leg pain, right? Down the right side?
Yes.
Some sciatic nerve pain? Are you having any of that back pain now?
Very light.
Very light, okay.
Sometimes.
So he's got a lot going on. And he's still relatively young. If I give you his age, then I give away my age. I don't know if I already gave that age away, but... Okay, you can see you're really fixated through here, through this thoracic region. So we're going to loosen that up a little bit. This posture here is also called upper cross syndrome. And I've done a video on that, upper cross syndrome, and how to reverse the forward shoulders and the forward head posture. And we're going to go through all of that with him in the next few weeks too. Sensitive?
Yeah.
Breathe in and out. Deep breath. So because this is his first adjustment, we're going to go easy on him today. I can tell here his hips are out of alignment already, so I'm going to have you slide up a little bit for me, Rolf. All the way up to the top here, a little bit more, a little more. There we go. So, as I said before, he's been to a lot of different doctors, ear, nose, throat specialists, neurologists, cardiologists, right?
Yes.
Yeah.
Electrophysiologist.
Electrophysiologist. So there are, costochondritis and hiatal hernia can cause so many other adverse symptomatology that you would never think would be related to what you're dealing with. They're mostly heart-related, anxiety-related issues. And with costochondritis, especially because you can't breathe, it hurts. It's a sharp pain when you breathe in, a deep breath. Yeah. So it makes it difficult for you to breathe, and that can create panic attacks for a lot of people because they don't know what's going on. They feel like they're having a heart attack, and then when they go to the ER, they get no answers because there is nothing wrong with their heart, right?
Uh-huh. And also went to the gastroenterologist too.
They sent you, and you went to a gastro. Yes.
Yeah.
Okay, we're going to have you turn over on your back. So, with the costochondritis, sometimes it might take some cold laser therapy over the chest area. We're going to see how you respond to a few adjustments first. Some people get better without the cold laser therapy, okay? Your case, we've had some real severe cases, and they need cold laser therapy on top of adjusting. So, we'll see how you're doing with that in just a week here. You're going to give yourself a big hug here. Tuck your chin down. Come on up. Do a half a sit-up. Yep. Deep breath in. Good. And blow all the way out. Good. And one more. Deep breath in. Good. And blow out. Okay. All right. Hold it. Hold that. Yep. Deep breath in again. Keep your chin tucked and blow all the way out. And just relax yourself. Nice and easy here, I promise, right? Drop the head back. Drop your head back. Okay. All right, lay back down on your stomach. Okay, bend your knees. Yeah. Take a deep breath in and blow all the way out. Good, and drop your legs down. And again, deep breath in and blow all the way out. Relax your shoulders. So it's like adjusting a brick wall right here. He's resisting me, but over the next few weeks, this is going to get a lot better. It takes time. So if you do go see someone to help you with your posture, understand this is years and years of bad posture. It's not going to correct overnight. But if he does his stretches and his exercises I give him, it will correct. And it will be a lot faster than just coming into the chiropractor. So you got to do your part. You got to do your exercises and stretches. Okay. But if you do that, you will get better a lot faster, okay? We're going to definitely be working on the mobility here of your thoracic spine, but what I want to do is the hiatal hernia maneuver, and I want to check your neck for the vertigo. So turn over on your back. So we're going to adjust your neck, okay? I want you to let me know if you have any dizziness right after, or if you get any dizziness, increased dizziness tonight, all right? And I'm gonna I sent you the Epley maneuver, so you can start doing that tonight too. Anytime you get dizzy, you go ahead and start the Epley maneuver, okay? Now I know turning to the left has caused some dizziness for you in the past. And relax yourself here. Okay, now I want you to sit up. Now stay right there. And you're going to turn your head to the left, and we're going to test again to see if you get dizzy, okay? So what you're going to do is you're going to, when you lay back fast, you're going to bring your head all the way back and keep looking to the left. So go ahead, 1, 2, 3. Any dizziness?
No.
No.
Yeah.
You sure?
Sure.
Look at that, folks. So in his initial exam that we did in the back room, he got dizzy when we did this before. So we just adjusted his neck, and now he's not having that. Test is no longer positive. So we're gonna just keep track of your vertigo here in the next few days. And whoops. And what I want to do is, if I need to, we're going to add the Epley maneuver, okay? Now I need you to bend both knees. Yep. Okay. Now we're going to do the hiatal hernia maneuver. Now, so he's having a whole bunch of symptoms associated with a hiatal hernia. So because of his hiatal hernia, he's having acid reflux, and that's really uncomfortable, especially when you have it all night long and you can't sleep and you get heartburn. And can you imagine hiatal hernia, acid reflux, costochondritis, and vertigo? And if any of you have had vertigo, it's not fun. I've had it. It's not fun. Trust me. Take my word for it. Okay, you doing okay here? It's going to be a little sore, okay?
Okay.
So here we just want to make sure that his abdominal wall relaxes. Sometimes that takes a minute. For some people, it takes more than a minute, a couple minutes. His abdominal wall is pretty soft here where I can get through it. He's not guarding me. He's not blocking me. Some people just tighten that abdominal wall. It makes it much more difficult. So really important to relax when this is being done. And there we go. You feel that? Okay, you can feel that pulsation that you were talking about.
Yes.
So he feels this constant pulsation in his upper abdomen area. And it's because of the hiatal hernia. Okay, do another one here. You might feel a lot of gas and burping right after I do this, okay?
Okay.
Breathe in and out. You okay? All right.
Good, yeah.
Now we're going to put you on a foam roller exercise for your posture. We're going to go in the back and do that and just have you lay on the foam roller and improve your posture more upright, okay?
All right.
So go ahead, sit up for me. Swing your legs to this side. Any dizziness when you come up?
No, but just
Okay.
maybe lightly.
Just a little bit?
Yeah, very
Okay.
light.
So we're gonna have to do, when you get home, you'll do the Epley maneuver.
Mhm.
And if the dizziness continues, you can do it again. Wait a minute and do the Epley maneuver again. You can even do it 3 or 4 times if you need to, but usually 2 or 3 times is enough. Thanks for tuning in. We're gonna do a follow-up with him, all right?